MONALEESA 3. Published in the Journal of Clinical Oncology, August 22, 2018. Phase 3 randomized study of ribociclib and fulvestrant in hormone receptor-positive, human epidermal growth factor receptor 2 negative advanced breast cancer, MONALEESA 3. This Phase 3 study evaluated ribociclib plus fulvestrant in patients with ER or PR positive HER2 negative advanced breast cancer. These patients were treatment naive or had received up to one line of prior endocrine therapy in the advanced setting. The patients were randomly assigned at a 2-to-1 ratio to ribociclib plus fulvestrant or placebo plus fulvestrant. Among patients with measurable disease, the overall response rate was 40.9% for the ribociclib plus fulvestrant arm and 28.7% for placebo plus fulvestrant. The authors concluded, ribociclib plus fulvestrant might represent a new first or second line treatment option in hormone receptor-positive HER2 negative advanced breast cancer. Thank you for watching.